Hi folks, my name is Sam Robles with Progress Texas.
Alia Khan with Planned Parenthood Texas Votes.
And we're coming to you live from the Texas Capitol because there are some dangerous pieces of legislation that are moving through the Capitol that would harm and cut local health care. Is that right, what we're hearing, Alia? What's moving, what's happening?
Yes, so Senate Bill 22 is only steps away from becoming law. It has already passed in the Senate and is very close to making it to the House floor for debate. So this bill is really, really important. It is the biggest threat that we at Planned Parenthood face. The bill would ban local governments from partnering with Planned Parenthood and other trusted healthcare providers.
And so just to give folks an idea of kind of what this looks like right now, we're in our final days of lawmaking here in Texas, right? We're just a few days away from legislators wrapping up the budget, school finance, issues like that. And while we've heard legislators say, you know, we're going to be focusing on the issues that matter most to Texans, we're still seeing extremist legislation like this roll through. So what tell us more about the impacts that this bill could have on local communities.
So this bill is a priority for Lieutenant Governor Dan Patrick. It's one of his top priorities that he announced at the beginning of the session. It is also a priority for anti-choice extremist groups. And I will say that the bill has really flown, I feel like, mostly under the radar for the session. It's not one of the bills, anti-abortion bills, that has kind of the more inflammatory language. But this bill's impact would really be devastating. So Planned Parenthood offers the full spectrum of reproductive health care at low cost for Texans who have insurance, for Texans who don't have insurance. So birth control, STI testing and prevention, HIV prevention, outreach education, preventative breast and cervical cancer screening. So really essential and life-saving care that communities in Texas depend on would be hit very, very hard by this bill.
And that so many people don't have access to on a day-to-day basis, right? We have a state right now that is choosing not to do anything when it comes to healthcare, and we have local clinics who are available to provide those services.
It's very clear from past examples of the legislature taking aim and decimating women's healthcare access that when they make decisions like this, they are not thinking about everyday Texans, particularly those who are medically underserved already and Texans who are uninsured. And we have the highest uninsured rate in the country. And Planned Parenthood really provides essential health care and is part of the healthcare safety net in the state. So taking that away is really devastating. And local officials from cities and counties have already
all over the state of Texas
have already signed on to a letter that was sent to House Speaker Bonin last month urging him not to advance this bill.
And I think for folks who are just tuning in, we're talking about Senate Bill 22 that is looking to defund local health care across the state. And so, you know, one of the interesting things about this, you said that this is kind of one of the bills that has been flying under the radar. One of the things that I think is really interesting about this bill is that it follows a lot of the same sort of kind of tactics that the state has been using this year. And what we're seeing is that now our state officials want to be our city council members and want to dictate what happens at the local level. And so I see this bill to defund local health care similar to that of paid sick days, and that helps ban the box and make sure that people who have been incarcerated are able to have an opportunity to get a job. I mean, this falls in line, and it seems like a huge theme this year at the legislature.
Yeah, I think that SB 22 definitely falls in that category of preemption bills. So bills that invalidate local law due to state law. So what this bill does is basically takes away the ability of cities and counties to determine how to best meet the healthcare needs and health education needs of their communities. So what is problematic is that what works in Austin or Dallas or El Paso might not work in the Rio Grande Valley and might not work in other parts of Texas. So we've seen historically that public health officials, local elected officials, they really know their communities best, and they are the ones that are closest to their constituents.
That's right. And
state legislators are overstepping.
Well, they're overstepping so much. And when I think about, folks who are watching and folks who don't have access to health care in Texas, one of the biggest things is we trust our local officials to make the best choices for our communities, right? We voted for them to serve in this office. They know what our city needs from hearing not only to us, but the communities around us. And then you have lawmakers who have ignored health care for so long, wanting to come in and do something like this, right? And so it's hugely frightening. What can people at home do? Folks who are watching right now, who voted for some really awesome elected officials that are doing some of the best things for their communities, and who want to make sure that folks across the state have access to health care.
So because SB 22 is so close to becoming law, it's really an all-hands-on-deck kind of situation. Today, Planned Parenthood in Texas is holding its Digital Day of Action. So we are asking everyone who supports reproductive health and rights to take action against this bill. In the comments section of this video, we have the link to our action page, where you can call your representative, email House Speaker Bonin. You can share your opposition to this bill on social. You can tweet at key legislators. You can update your profile picture. You can share your story about why Planned Parenthood matters to you. And really what we're trying to do here is to make it clear to everyone in the Texas Legislature that Texans really do stand with Planned Parenthood, and that this bill would be extremely detrimental to their communities. And excitingly, people have already taken a lot of the actions that we've asked. We're so grateful for everyone who's taken an action. We have over 2,000 signatures on our petition to Speaker Bonin. We'd love to get to 3,000 signatures before the end of the day. So if you haven't taken that action, please do so. And our hashtags, care no matter what, and stop SB 22 are trending. So follow us on Twitter, join the conversation. Please get engaged with us and make your voice heard.
Absolutely. And folks who follow us on Progress, I need to always make sure I make this note, right, and remind y'all, what did the 2018 elections do for us here at the legislature? And we're seeing that legislators are really thinking about, how do we fund schools, how do we do this? We've seen less attacks on our communities, but this one right here is a huge one, right? And it's going to impact not only institutions that provide health care like Planned Parenthood, but everyday Texans in your community. And so we need your voice. And I think just to remind folks where we're at the process, we're just a few days from the legislature wrapping up all their lawmaking, right?
Yes. We're
a few days, and your voice is so critical right now. And so we need you to take action. Can you come closer into the frame? Thank you. We need you to take action, because these lawmakers are going through bills so fast, and it could be so easy for them to miss something. But we also need to hold our people accountable. And so we might have some lawmakers in Dallas who might not know that this is an issue that's important to their constituents, or some folks in Dallas who were really close to losing their seat. And this is an issue that you in your area are watching, and you need to let them know that this is an issue that they need to vote against, and make sure that we are funding our local health cares.
This is really about protecting local health care. A lot of the anti-choice extremist groups have focused on Planned Parenthood specifically. It would impact other trusted healthcare providers. But what this does is take away local government's ability to make all of the healthcare resources in their community available. And it has been proven from past actions by the legislature that when the state politicizes women's healthcare, women ultimately lose access. 2 years after the state removed Planned Parenthood from its family planning program, 30,000 fewer women received health care. So the numbers are very clear that Planned Parenthood is providing essential health care, and that really there isn't another provider that can step in and fill that gap. So, making this hole in the healthcare safety net is really problematic, and I think that we need to focus on the fact that local governments know how to best meet the needs of their communities.
Absolutely. When I think, I used to work in the Texas Senate, and when I think about the district that a state senator might hold, that has several cities, right? And that elected official isn't always in that district all year long. but we trust and we vote for people who are in our city, who are in our county, who are watching the day-to-day issues to make the best decisions to fund our healthcare and to fund other public services.
And I'll say also that, Planned Parenthood has been a trusted community partner for decades. So we have a proven track record of doing what's best for communities. We've also been able to step in when there's been a public health crisis. Our Planned Parenthood Gulf Coast affiliate stepped in right after Hurricane Harvey. We've helped during the Zika crisis. So in times where healthcare resources are strapped, Planned Parenthood has been able to provide additional resources, which are really important and critical to people in those communities. And additionally, we provide those services in conjunction with these local governments. And as I said, these have been partnerships that have existed for decades. So there's really nothing controversial about, a 40-year partnership that we've had with, for example, the city of Austin at our East 7th Street Health Center. This is about politicizing women's health and taking away access in order to score political points. And we just, we can't stand for it.
Absolutely not. And so for folks who are just tuning in, Alia, what do they need to do? What do we need to do to make sure that bills like SB 22 don't pass the Texas Legislature this year when we have just a number of days from wrapping up?
So today is our digital day of action, and we're urging everyone who supports reproductive health and rights to take all of the actions. The action page is linked in the comments below. And all of those actions, taking all of them, will take you less than 15 minutes. So we've made it quick and easy.
On that lunch break right now, as you're on your lunch break right now.
Yes, you can do your civic duty just right, within 15 minutes to let your representative know that you are opposed to SB 22 and that you are determined to protect local health care. So we have a number of different actions: calling your representative, emailing the House Speaker, showing your support for Planned Parenthood on social media. All of these things really help amplify this message. And also, we want to make sure that legislators are hearing from you, from the people of Texas, that they're not just hearing from Planned Parenthood or one of our other progressive partners who we love, but we want to hear from constituents that, hey, I went to a Planned Parenthood clinic,
and this is what they were able to help me with. Alia, like the story that you're talking about, when Planned Parenthood was able to provide services to folks after Hurricane Harvey or during Zika, that's huge, right? You all are talking to Texans past, you're helping provide services. It doesn't, this isn't a political thing. You're making sure that people have access to what they need.
Yeah, and I mentioned earlier that our community health center in downtown Austin on East 7th Street has been a particular target of this legislation, although the bill has very broad implications and would affect every single county that we serve in Texas. But for example, that health center has been there for 40 years. We have a lease agreement with the city of Austin, and each year that health center is providing preventive essential health care for thousands of people that live in that neighborhood. And there's really not another healthcare provider that can provide that same level of affordable, high quality, non-judgmental health care. And recently that health center started offering gender affirming hormone therapy. So our goal is to serve all Texans and to make that health care available, whether you are insured or uninsured.
And we appreciate that so much, because we know that all over the state there are so many people right now who are struggling to find access to quality health care, affordable quality health care.
Yes.
And so when we hear that there are clinics in our neighborhoods across Texas that are able to provide these services, and now that the state wants to cut that funding for local healthcare centers to be able to provide that sort of care, we know that these lawmakers are so out of touch to the real needs that people have.
And one thing that is a little bit more on the technical side, but the bill creates a new term, taxpayer resource transaction, which is a totally new term. It's never really been used before. and it limits taxpayer resource transactions between local governments and abortion providers or affiliates of abortion providers. And what we expect from this new terminology is that it would be applied so broadly that we anticipate some of the serious impact of the bill, but we don't even really fully know until the bill is implemented. Yes.
Yeah, and so it sounds like not only does the state legislature, not only does Governor Abbott or Dan Patrick want to be our city council members of Texas, right, by telling us we can't have paid sick days. Local communities can't pass paid sick days, or you can't pass ordinances that would improve the opportunity for people to find jobs after incarceration. But it sounds like they now want to tell us what to do with our taxpayer money. And they're telling local communities what they can do with their taxpayer money and how they can and cannot spend it.
And no taxpayer funding goes to abortions. A lot of the proponents of this bill have sort of used the phrase defunding the abortion industry. That's really, it's incorrect. I think it confuses people. It further sort of perpetuates this idea that this bill is no big deal. We're just doing something that people want us to do. But in truth, this bill is an attack on local health care and would ultimately result in thousands of Texans losing critical access to services that they rely on to live healthy lives.
Absolutely. And we are just days away from the legislature ending their lawmaking. They've gone through the budget, they're trying to figure out school funding, and now they're taking up all sorts of bills, and one of these is a really dangerous bill that would cut health care for our local communities across the state. And we need you to take action. We need you to remind Speaker Bonin what the costs are when you cut local funding to our communities across the state. What else can we do?
You can call your representative. I think that is one of the most important things you can do, because they need to hear directly from you, your constituent. And on our action page, we've made it really, really easy. You can call a number, you'll be connected to the switchboard, you tell them where you live, they'll connect you to your representative if you don't already know who that is. So we've made all the steps really easy. Amplify your voice on social media. Please use our hashtags and join the conversation, and make it clear that you are committed to protecting local health care and standing with Planned Parenthood.
Make it clear, make it loud. Take 15 minutes today during your lunch break. If you're going on a walk, just needed some space, get on the phone and call your state rep. Call Speaker Bonin. We need you to take action today. Thank you all so much.
Thank you.